As the new case numbers rise, our local hospitals are making no secret of the fact that they are overwhelmed. I had a chance to sit down and talk with one-on-one with an ER nurse at Deaconess. She tells me they're doing the best they can, but the strain is real and it's likely going to get worse before it gets better.
Over the last 3 to 4 months, it seems like things have just been extra stressful at the hospital. Part of the problem is the hospitals are so full. So every day when I come in, we have 23 beds in the ER, and sometimes 23 beds are full of hospital admitted patients that are waiting to go upstairs.
People have so many questions when they hear about all the hospitals being stressed. What does that mean for you working in the ER day in and day out?
So we're trying to get really creative here to see how we can still see the ER patients.
What does that mean, getting creative?
We've made 11 hallway beds. Pretty much anywhere there's a wall and we can put a bed, we'll put a bed. And sometimes we see patients in chairs. We've created areas in the waiting room to see patients, also trying to maintain their privacy, of course, but we just got to get creative. We got to find space to see everybody and take care of them.
Do you think people outside in the community who aren't part of healthcare really understand how bad it is?
No, and I think what's really important, what I wanted the community to know, is it's not just our COVID patients. Like, yes, that's making things difficult. We're still recovering from last year, the shutdowns.
Is this the new norm?
I hope not, but I mean, it is going to be for a while. I mean, even when the COVID numbers go back down, I mean, we're canceling surgeries left and right to just try to control the flow and the amount of patients in the hospital. So we're going to be recovering from that for a long time.
So we've also heard about how dire it is in Idaho, North Idaho specifically. How has that played a role? Are you guys getting patients from across the state line?
I think yes. I mean, we always have, we kind of share our community because we're so close. I know as one of the lead charge nurses in the emergency room, every single morning I meet with every charge nurse of every floor. I meet with the OR team and we talk about how many rooms we have available, the outlying rural hospitals that need to send people in, and that's also challenging. Sometimes they don't have anywhere to go.
Do you feel that vaccinations are kind of the ticket out of this situation?
I think that the vaccination seems to be such a hot topic for everybody right now, right? I mean, I'm vaccinated. I feel like I'm doing what I can to help take care of people. I'm going to take care of people no matter what.
Because once they come through your doors, politics aside, right? I mean, you just want to take care of patients.
Oh yeah, definitely. And that's how it's always been. That's how we always believe. Every nurse feels that way. It doesn't matter what your health insurance is or if you have none. It doesn't matter what your political stance is. If you're vaccinated, we're here for you.
Is there anything else that you want people to understand about just what it's really like? You know, we're out here right now. It's a beautiful day. It doesn't feel scary in any way. But once you go through those doors, it's pretty serious, isn't it, right now?
It's very serious. I know personally a lot of the nurses are having a really hard time coming to work. I think one of our biggest challenges is knowing the care you want to provide, but not always being able to provide it because you're stretched so thin.